Doctor, just wanted to check first thing is about obesity, the increasing obesity, and what are the different kind of treatments which we have it in that.
See, when we come to obesity, you need to divide basically it's a mild, moderate, and extreme obesity. So when we crossing, we call it a BMI. So when BMI is crossing more than 35, in proportionate to this height and weight, then we call it as a morbid obesity. So when we come to morbid obesity, we have not many choices available, because most of the times these morbid obesity people, they don't get respond well with exercise and all these things. They were tried and tested and failed. So these people usually come to us as a lost resort. So they already tried everything and they are come here for us for a one surgical choice. So most common choice we suggest is what we call as a bariatric procedure. So bariatric surgery has 3-4 common surgeries. One is sleeve gastrectomy, where we trim the size of the stomach, and there are the bypass procedures where we attach the early small intestine to the large intestine so that we bypass all the absorption. So these are the two main categories of surgeries if we would divide into.
And what will be the post-operation experiences?
So basically this most of these procedures are day care procedures. So patient will be typically stay for a day in hospital, and after that in terms of pain, it is very minimal or almost negligible pain they experience. And day one we make them walk and we make them ambulate, so they can actually walk back to the home. And but first 1 month we will be giving special diet, restrictive diet, which is again a liquid diet, which they'll be taking as per the chart we give, and our nutritionist usually guide them. And to see the visible differences, usually it will take 3 to 6 months time, but the complete results is always for 1 year. So they can expect the weight loss of 30 to 40% of their body weight. Let's say if you're coming with 150 kgs with a 6-foot man, so probably you can expect to lose 60 kgs in 1 to 1.5 year time. Yes, and this weight loss is kind of permanent weight loss. So very unlikely they'll actually gain back the weight.
Does it have any side effects?
Yeah. So when obesity as such is we call it's a metabolic disease. So because a lot of times most of these people come with the early diabetes and hypertension and fatty liver. So these are all conditions they come with. So most of these things will get cured with the procedure. And if they're already dependent on diabetic drugs, most of the time it is cured forever. It is a kind of, that is the reason we call it a metabolic surgery. So we are reversing certain damage which is already done by the obesity. All of them can be reversed. And you will have some vitamin deficiencies they might come across, which we can cure with certain simple injections or some oral supplements. And as such, if surgical procedure goes well, and if they have pre-existing fitness for the surgery, the complication rate is almost negligible.